Hi, everyone. I'm Alex Savage at KTVU, Fox 2 News in the San Francisco Bay Area, and we are talking today about some of the latest news having to do with the coronavirus outbreak with Dr. Vanila Singh, a critical Stanford professor and also the former chief medical officer for the Department of Health and Human Services. Dr. Singh, it's always good to talk with you. Let's start with some of the news we have here in California just today. Word that here in the Bay Area, officials are going to be extending all of the social distancing rules and the stay-at-home orders at least through May. Does this make sense to you based on what we know in terms of the data?
Hey, Alex, great to be back on. So certainly the extension of social distancing makes sense at this time because we know the primary mode of transmission is in essence the respiratory droplets or whether they're droplets even from saliva particles, but keeping that 6 feet away allows for us to diminish that risk of getting it if someone is showcasing symptoms of cough or sneezing or whatnot. So that makes good sense at this time.
So this past weekend, we're a number of weeks into these orders, depending on exactly where you live. And this past weekend, you probably saw some of the images online. Some of our beaches here in California were pretty crowded this weekend. Granted, it was gorgeous weather, lots of sunshine, and even Governor Newsom a short time ago was sort of scolding people for packing these beaches. Do you think there is sort of this quarantine fatigue that is starting to develop here? And from a public health standpoint, how do you combat that?
So definitely from the individual's perspective, absolutely. There is a quarantine fatigue, cabin fever going on. It's been so challenging when you think about how many weeks we've all been forced to shelter in and stay in unless you're in a critical industry and are able to go to work. And the good weather doesn't help this any because there's a sense of needing to get away. I think people feel like they'll feel healthier, need to stretch their legs and get out, and perhaps even feel better about the future because being cooped in the house, watching the news and these statistics makes people concerned and anxious. On the other hand, from the public health perspective, we know that our public health leaders, our scientists and all are, of course, wanting to contain this in this very important time to really flatten the curve for the medical system and get us over the peak. We have good news in that California has done well, but I think what you really see is this yin and yang of the one side, people who are responsible for the virus and its outbreak, seeing this as a continued effort to keep people in and be mindful of the social distancing. The upside to folks who want to go to the beach is that you can actually do this if you do adhere to the 6 foot apart. And I think it makes the job easier for everyone included. And so a few don't want to ruin it for the many. And I think that, hopefully we can continue that message.
Yeah, absolutely. It sort of raises some questions about your level of risk of exposure to the virus in that outdoor setting versus an indoor setting. Because obviously we've shut down the restaurants, and a lot of people aren't going to their places of work, but people are still trying to spend that time, as we saw, going maybe taking a trip to the beach or just getting outside for a walk or a bike ride. How much risk of exposure is there when we're out in the open to the virus? Let's say just sort of passing by someone on the street.
So, inherently, and I think intuitively, a lot of folks have told me that they feel healthier and better when they're out there. And they may not be wrong, in fact, because there are studies that already showcase that, for example, even out of China, there was a study that highlighted that when they looked at viral outbreaks and they had defined it as 3 or more people who got the viral outbreak, the vast majority of them got it at home or on the transportation system. There was only one that actually showcased an outdoor environment issue. The other thing is that the Department of Homeland Security, with their recent findings that they shared at the biocontainment lab that they have in Maryland, they looked at how the COVID-19 virus is stable or unstable in different environmental conditions, which makes a lot of important sense. The National Academies of Sciences have reiterated the important value of this. So they looked at temperature, humidity, and they looked at solar light, specifically UV rays of the solar light, and they found what I think maybe some of the people are intuitively feeling is that the virus, like some other viruses, is less stable and rapidly deteriorates when exposed to higher heat. It rapidly deteriorates when it's exposed to higher humidity, but it definitely more dramatically than any of those other conditions deteriorates pretty quickly in sunlight, which is really UV light. And so I think when people want to get out there, that's probably the sense that we have as human beings, that we're safer. But to your point, if you're running with someone, walking with somebody, how do you make sure that you're safe, but especially someone you're coming across, and do they get within that 6 foot range? What's your risk? And really the risk is if they are symptomatic, then you may have a chance if you're within the social distance. You know, one of the reasons the facial coverings make sense too is that when you're out and about, going to critical centers or outdoors exercising, you know, with the outdoors, you can keep that distance, but sometimes in closed areas you can't. And so to minimize that fear that we have that someone is within the social distance, you could have the facial covering, and that might protect them from you and you from them.
Yeah, there was also this sort of issue was studied. It sounds like in China, in Wuhan, and they looked at the fact that they found coronavirus lingering in the air in some of these crowded spaces within a couple of hospitals in that city, which was obviously the epicenter of the original outbreak here. How much concern is there about the coronavirus spreading through aerosols, through those tiny droplets, those particles?
Yeah, so great question. This has been a lot of fear in this area, and concern for good reason, because when we learn that the virus can actually be in the air, that's concerning because we think, well, we're more exposed. But really the biggest risk of exposure from an aerosolized potential infection or transmission is in the operating room when our surgeons and anesthesiologists are actually going into the lungs to perhaps put a breathing tube or doing some special surgeries that can actually put those doctors and other healthcare workers at greater risk, which is why the PPE in those particular conditions are so important. The upside is that for the average person out and about, it is not considered the number one way of transmission. In fact, the vast majority, again, is really considered to be through the respiratory droplets that come from coughing and sneezing and such symptoms. And so that's the upside of that, is that the vast majority of the CDC guidance and all the guidance that we're seeing at federal, state, local levels are really pertaining to getting out of that distance, and then also the additional hand hygiene and washing your hands, so that if you touch a surface that does have those droplets, you rapidly ensure that you don't touch your face without hand washing. So all of these measures are really to curtail that.
You spoke a bit about the CDC and their guidelines, and it was interesting because I was reading today that the CDC has expanded the symptoms that people should keep an eye out for to identify, the coronavirus. And originally, I remember just a few weeks ago, feels like forever, but originally we were just talking about the fever, the dry cough, and the difficulty breathing. And now the CDC is talking about new symptoms: chills, repeated shaking, muscle pain, headache, sore throat, and then that loss of taste or smell. What's behind expanding these guidelines? Is that just going to maybe give more people a heads up that they may have coronavirus and not know it?
That's exactly right, Alex. It is really to help the average person understand what are the symptoms to look out for, give them a heads up so that they can self-quarantine early enough, perhaps reach out for a test if they think so. Really more important, reach out to your doctor, provider. But yeah, the expansion goes to a lot of the studies and stories we're hearing from people who were relaying that one of the first things they felt was a loss of taste or smell, but also some of the other typical symptoms that we see with flu and other things like myalgias, muscle pain, just to make people aware, to expand, because none of these things none of the viruses in the past or COVID in the present present the same in all of us. We are individuals. We have a unique biodefense system, unique inflammatory response, a unique way that our body may fight the virus. And so it will showcase in all of us likely differently. And so it's really to expand that. And I think I would just say to people, this is more information meant to better prepare you, but not to make you that much more anxious, but rather know that we're getting even better armed in understanding the virus.
Obviously, we know that one of the other keys to trying to get things reopened in a more broad sense across the board is going to be ramping up the testing. Every day we hear about more and more testing sites that are opening up all over the place, but we're still not to that point where any person who wants a test can get a test. How much longer do you think until we're there?
Well, testing, it sounds like something that, boy, we should be able to do, but really this kind of effort of testing has never been done before. This level and suddenly in this era of high information, everybody's like, oh, we should all get tests. So the first thing is that I just want to say that I heard hot off the presses is that the White House task force is issuing new federal guidelines on ramping up testing today alone. I don't know all the details on it, but I did hear people say that really what it amounts to is about 2% increase in testing, and it would really emphasize the certain groups that should get testing, those who are vulnerable, medical workers, and others who are really on the critical front lines. And then it also gives an idea of how to surveillance test those who are high risk. And so this is really important news. And there are so many efforts in the last few weeks alone that have allowed for us to get private labs, private companies to really help us in the ramping up, because the issue isn't just sampling people, it's who can run the tests and also what kind of tests can they run. Until now, we've had to take the genetic code of the virus and then to really get it replicated so we can detect it. That's a polymerase chain reaction PCR test. It takes time and it takes a lot of invasive testing. Now, hopefully we can actually get better testing, maybe perhaps from saliva and other ways that are much quicker turnaround. And so I think all of these efforts really can allow us to get to the point where we feel safer that the people who need to be watched are watched, those who are in critical conditions on the front lines, or those who are vulnerable. And I always say this from the beginning, if anyone feels like they may have symptoms, to do two things. One is to call ahead to your doctor, get some advice about where you should go if you need testing. And number two is to self-quarantine yourself regardless. And we know those are good habits even when we didn't have COVID. It was important to do regardless.
Yeah, exactly. That's a good thing that we should have all been doing all along, whether it was just a seasonal, flu or a cold or whatever it was. That's certainly good advice to avoid spreading the virus. Let me ask you about the hospitalizations and where we stand there, because we it seems like, at least here in California, and it sounds like in New York and other parts of the country, things are stabilizing. To a point where the hospital systems don't seem like they're overwhelmed. How optimistic are you that in terms of that surge of COVID patients coming into our hospital system all at once, that we're kind of past that peak?
Yeah, I'm very hopeful. It is and was a very important initial concern, which is why we did all these efforts of social distancing, hand hygiene, and face masks, etc. Was really because of this potential modeling that was showing these worst case scenarios of our hospital systems getting overburdened, specifically because of hospitalizations and then ICU care and ventilator use, etc. So I think we're at the point where in so many parts of the nation, we can safely say that they are stabilized and they have the resources should an outbreak occur, because an outbreak can always happen locally at some level, and good surveillance testing will allow us to jump on it and get people the treatment they need early and often as needed. I also understand there was no one in the US that did not get a ventilator if they needed it. In fact, I understand the federal government is helping some of the other countries who don't have the resources with some of the excess ventilators, which is always a really good sign. and something that, you want to see in terms of a world effort. But that important point of hospitalizations and critical care unit access is really important to continue to keep their, a lot of folks put off their own medical care, which, by the way, is something that I think is really important to turn our attention to as healthcare systems across the country reopen to these other, what they're calling elective, but, ultimately, most of these things need attention, and they were just surgeries and procedures and healthcare that was really just put off.
Yeah,
So,
and a lot of that stuff is happening once again, which is good for those patients. We it seems like we're past, we're past the peak, it would seem, but there is, as you know, this talk about a reemergence of the virus and this sort of second wave that we could see happen later in the fall and the winter that coincides with the seasonal flu season, but coincides with when we normally would see seasonal flu. How much concern does that give you when you have coronavirus potentially reemerging and the seasonal flu at the same time?
well, it gives me great concern because of the potential you see is that while people will be potentially coming in to seek care for the regular flu that we're used to, the regular cold, and now add COVID. So that's always a concern, and we need to continue to look at ways to really mitigate that sudden surge. The advantages that we have right now are that, one, we know about this virus. We didn't know about it before. It's new. And so the last 2 months have provided us great ample opportunity to understand it. There are things that I think hold some promise, although studies have to confirm them. One is, how much immunity do we have after somebody
Yeah,
had the virus?
I was going
So
to ask you about that. Yeah,
right,
yeah,
and that's a great
yeah.
question, right? Like, a lot of folks want to know, do they have partial or complete immunity? Really, some of the answer to that's going to depend on how much the virus mutates. Does it stay the same? There's always some genetic drift, is what it's called, but to date, it seems like there hasn't been that much of a variance yet. But the studies will show us better, and the fact that they're taking the plasma from people who've already had the virus and are giving it as a form of treatment to others is really interesting, and I look forward to all that data coming
And
out.
the World Health Organization did say that they were not able to find evidence that a person who had been infected with coronavirus, was not at risk of being reinfected, that they had immunity. They didn't find clear evidence of that. That doesn't mean that's not the case, right? I mean, it just means that they were not able to pinpoint that to be true for sure.
Exactly. So, these are always confusing statements when someone
Yeah.
says there's no evidence. My interpretation was that it means there's no study out yet that has definitively said there is a benefit or not. And so, but the reason people believe there is likely some conferred immunity is because historically that's been true of other viruses or other infectious diseases, that when you see it, you get immunity to it. That's the whole premise of the vaccinations we get for all kinds of things from childhood onwards, right? Is
We
that
get a small
we
bit of
get,
that virus and it makes us immune.
exactly. And so it's on that basis that the whole idea comes that we may have immunity. And so it would be great to hear just how much, and really, I think it would give us a sense and really a head start in some ways of the second wave. I would hope in the second wave, this virus is not mutated to some more virulent strain of the virus. But I think having the head start and understanding and looking forward to it with all our social distancing, hopefully by then we're well practiced, even in where we reopen the economy, we are going to reopen it in a different way to take away unnecessary risks, but also functioning as a society. So I think it's good to have that idea out that there's a second wave, because that's how these viruses function, especially knowing that they are, better able to thrive in colder temperatures or drier climates and less sunlight. But
And
knowing that,
you could say one of the keys is we don't have a vaccine for coronavirus, but we do have a vaccine for the flu, right? And so, I mean, one way to really protect yourself, if you're, once we get into the fall, winter months, is to make
such
sure
a
you have
good
that flu vaccine.
Exactly,
Well,
such an important point, and thank you for saying that. I mean, if you think about it, us doctors, nurses, we're all required to have the vaccine, the flu vaccine, to even work in the hospital and those settings. And so why is that? That's because we know that we're at risk, and worse yet, we wouldn't want a bunch of medical staff to suddenly not be able to work. It minimizes it, in terms of getting the illness. So yes, I think this is such an important time to make the case for the flu vaccine and to not hold back, so that that's yet another defense against an outbreak in the fall.
yeah, you got to take every precaution that you can. Let's wrap up here, Dr. Singh, with sort of looking to the future, and we're talking about social distancing guidelines being extended in many places, including here in California. We heard from the White House Coronavirus Task Force about potentially a lot of these guidelines being in place at least through the summer months. This is something, as you just kind of alluded to, that we need to get used to. So what is your message to people about how to kind of embrace this new lifestyle where we're going to be keeping our distance, we're going to be taking certain precautions?
Well, the way that I think people will feel good about it is remaining calm and taking care of your own wellness while being absolutely well informed, to go forth in the summer months and try and do our part to really think of it as not harming those in our society who are at risk. And if you feel that, you feel a sense of empowerment. If you're somebody who is vulnerable and at high risk, know that so much of society is doing this effort really to ensure that your risks are minimized, but staying in touch with your doctors, especially your friends and family, because one of the things we can do is keep aware of our own personal health, our own mood, make sure that our sense of wellness and calmness is there, because those are things we also know can negatively affect us. So there's going to be plenty of information to stay informed, to not look at worst case scenarios. We've got professionals to do that, but rather to just do what we know, which is really, actually, even though it's not easy, it is pretty simple in terms of maintaining the social distance, stay in shelter, get some exercise, get out in your backyard or front yard, get some sunlight, and ensure that you are, taking care of yourself, and maybe take a moment to watch some movies or Netflix.
Yeah, absolutely. Yes, take care of your mental health. That's really a key to all this too. All right, we will leave it there. It's always good to chat with you about some of these really important topics here related to the outbreak. We'll do it again next week. Dr. Vanila Singh, critical Stanford professor and former chief medical officer for the Department of Health and Human Services. Thank you so much for your time today. I appreciate you coming on, and I'll let everyone out there know we have more information up at our website. It's coronavirusnow.com. I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area. Take care.